Welcome everyone, and thank you for joining us today. I'm Hanbyul Choi from the Korean Disability Forum. And I'd like to show our warm welcome to everyone joining us today for sharing your experiences and insights of the International Cooperation in Disability Rights Organizations. 네, 여러분 오늘 와주셔서 너무너무 감사합니다. 오늘 저는 한국장애포럼의 최한별이라고 하고요. 오늘 행사를 통해서 저희가 장애계가 국제적으로 또 아시아 지역에서 서로 어떤 이야기들을 공유하고 있는지 또 이제 함께 이야기 나눠보는 시간 되면 좋을 것 같습니다. So I would like to invite Jong-sul Yoon for his welcoming remarks. 윤종술 대표님.
안녕하십니까. 한국장애포럼 상임공동대표 윤종술입니다.
Hello, my name is Jong-sul Yoon, Executive Representative of the Korean Disability Forum. I'd like to extend my warmest greetings of solidarity to all of you at the 2024 conference on the disability. I believe that so many of you are here because we are connected to each other regardless of borders, and we are stronger for it. This is the fifth of the year of the Global Disability Conference, and we have seen that we are connected as we look together at the situation of people with disabilities around the world, which is being further impacted by COVID-19, the climate crisis, war and crisis at home and abroad. We have also seen that what happens in one country or region is a shared challenge in every country, in every region of the world. No one is safe until everyone is safe. No one is free until everyone is free. No one is dignified until everyone is dignified. And now we must find ways to extend our solidarity through these connections and work together to address and respond to the common challenges we face. I hope that today's gathering will lay the groundwork for us to explore, celebrate, and encourage each other in the disability community, particularly in Asia, to share what issues we have identified as common challenges, what effort we have made to address them, and how we can strengthen the solidarity in the future. First and foremost, I would like to thank all of you for joining us for this important occasion. I invite you to join us in the future as we continue to build solidarity in the disability community. I would also like to thank our speakers today. We appreciate your dedication to advancing disability rights around the world and look forward to the insights, ideas, and recommendations that you will bring from your valuable experience. I would also like to thank the KDF Secretariat for their hard work in making this day possible and all the organizations that you have joined us as co-host. Thank you.
Thank you so much, Jong-sul Yoon. Yeah, actually, Ms. Carol Dondorf-Dorj, who is the UNCRPD member, also sent her remarks, but I think since she had some other contribution right now, so you can read her congratulatory remarks at the link of the written speech that we shared via chat box. All right, so Now I would like to leave the floor to our today's moderator, Wakar Puri from the TCI Global, and who is also very strong activist, and who is our colleague, recent. I'm really proud to introduce him as our moderator. So Wakar, the floor is yours. Thank you.
Thank you so much, Hanbiol. Thank you so much for handing over the flow of the program for this event from here to me. And I just want to first start by thanking Yeonshun Yoon for your very strong statement, and thank you for creating this space for us as KDF. We really commend the work Korean Disability Forum is doing to build the international solidarity and facilitate OPDs to share learnings. We also appreciate all your efforts for establishing the Asian Coalition on deinstitutionalization, and we are happy to work with you and take forward the work with you and in collaboration. So, good afternoon to everyone in the host country, and good morning or good evening to people who have just who have joined us online today. My name is Vakar Puri. I identify myself as a person with psychosocial disability, and I am working with Transforming Communities for Inclusion, which is a global and independent OPD of persons with psychosocial disabilities. It is my pleasure to welcome you all to this event, including all participants, speakers, panelists, organizations who are participating in this Global Disability Conference physically and virtually on Zoom. And I want to extend my heartiest thanks to all partners who have joined hands for this conference, and for creating this space for all kind of stakeholders working at the national, regional, and global levels, to share their learnings and develop some recommendations for building international cooperation for disability inclusive development and our inclusion in the SDGs, which is very important. And we see that most of the movement and mostly people with disabilities are still left out from the SDGs. As part of the Asian Coalition on Deinstitutionalization and on behalf of the ACDI, I want to start. As I mentioned, I want to once again thank Korean Disability Forum for organizing this very important side event. And today, during this event, we will hear about some challenges, some gaps, best practices, and recommendations in order to facilitate international cooperations for inclusion of people with disabilities in SDGs and development processes. Alongside, we would also acknowledge the ongoing efforts. We should never say that, okay, this is missing, but it is also very important to acknowledge what has been done. So we also acknowledge the ongoing efforts of UN agencies, UNESCAP, as well as all of us, what all we have been doing since many years, all of the civil society organizations, state parties, for working on the disability inclusion and inclusion of persons with disabilities in the SDGs. But just to give the context for today's discussion, sadly, I still want to emphasize that we are still far behind. And there is a lot to be done as a whole of society for inclusion of people with diverse disabilities. Still today, if we see that people with disabilities are left out in all aspects of their lifespans and are denied access to health, education, social, economic, political, and cultural opportunities. People with disabilities still remain out of the decision making processes, and we are still seen as lesser beings in our society. So we have a list of speakers today and list of experts who will be sharing with us how we can address this gap and build national, regional, international solidarity. I would also want to emphasize on behalf of TCI and ACDI that the issue of institutionalization of people with disabilities is massively increasing in various countries. And instead, that the governments and donor agencies invest on grassroots community inclusion solutions, stakeholders continue to invest and allocate money for either building new institutions or either renovating the existing institutions. The communities and families see us as burden on them, and hence we are either sent to the closed door institutions or we are institutionalized within the homes. We are discriminated, we are stigmatized in the communities, we have no access to mainstream services, and the list of issues is just massive. There are many gaps we see that should be addressed by the state parties at the policy level. The legal laws are still too discriminatory that people with disabilities are denied to exercise their legal capacity as other citizens of the countries. In many countries, we have learned that people with disabilities are still seen from the medical perspective, and there is a still lot of work to be done for changing the paradigm from the medical model to the human rights model. When we talk about women and girls with disabilities, young people with disabilities, they are doubly discriminated in our societies. And they are subject to violence, they are subject to physical abuse, they are facing forced institutionalization. Women and girls are facing forced sterilization. We have no access to justice. People are not encouraged to accelerate in the mainstream society, and so on. So we'll now move to the panelists and we'll listen to our listed speakers today, how we can address these issues at the national level by building international corporations, and how we can, as a movement together, we can, progress. And what is our responsibilities as civil society stakeholders to work as a whole of society for disability inclusion. So I would first hand over to Kushik Lee, the executive representative of Solidarity Against Disability Discrimination in Seoul. The floor is yours, sir.
네, 안녕하세요. 저는 서울 장애 잡혔는데
Hello, my name is
저는
Kusik Lee, and I am executive representative
있습니다.
of Solidarity
반갑습니다.
Against Disability
제가-
Discrimination,
제가
SADD, in Seoul.
근데요, 좀 이해해 주시고 잘 들어주시기를 바랍니다. 유엔 장애 권리위원회 차이시절 가연이 앞에가
Today, I would like to present the reality of Korea, where the right to the institutionalization is denied. And
저는 오늘 전반적으로 사회자의 권리 하나 한국의
and I'd like to present what the Korean disability movement is doing to ensure this right.
이에 대해서 한국의 장애 운동의 권리를 보장받기 위해서 어떤 활동을 하고 있는지 이야기하고 있습니다. 특히 제가
In particular,
한국 권리
Solidarity Against Disability Discrimination, SADD, of which I am a member, has been active in Europe and elsewhere during the Paris Paralympic to call for international solidarity to ensure the right to DI in Korea. I would like to share these stories with you.
제 소개를 뒤에
소개는 뒤에 하신다고요?
네.
아, 네.
지금 좀 뒤에 소개를 먼저 뒤에 하고 넘어가겠습니다. 저녁이 비 여덟 여덟부터 29살까지 시집을 해서 살다가 이렇게 나 나왔습니다. 그또이
originally was in the institution, and I got out of the institution.
1999년 그때지 이부터다가 뜨던 지금도
Have been involved in the disability
나
movement, including the right to
기술에는 가장
mobility,
있고요.
the struggle for personal assistance services, also the enactment of Act on Anti-Discrimination Against Persons with Disability.
그 시절에 정책이 시작
Since 2021, I have been the executive representative of the SADD in Seoul. Seoul was the first city in South Korea to launch the institutionalization policy. In 2009, 8 institutionalized people with disabilities took to the streets of Seoul to demand deinstitutionalization and began sleeping outside in a park. They shouted that people with disability have the right to live in the community, not in institution. As a result, the city has put in place policies to support the DI and has developed a plan every 5 years. However, 15 years later, the city continued to deny people with disability the right to live in the community. Seoul's Mayor Oh Se-hoon, along with parents and conservative politicians who opposed the institutionalization, has repealed the Seoul Deinstitutionalization Ordinance, the first ordinance on DI in South Korea.
부모 및 보조 정책들과 함께 한국에서 사시들과 권해 가장 먼저 정책된 도래인
Also, the Oh Se-hoon, the Seoul mayor, in terms of policy, he has eliminated the residential institution linkage project, which was run by community organizations such as the Center for Independent Living for People with Disabilities, to meet with people with disabilities living in institution, to introduce and support them to deinstitutionalization.
기업사회 전체들이 수준에 구조하는 장인을 직접 만나서 수술에도 소개받고 지원하기 잠깐만요. 위에 운동을 했었던 구조시설 연계사업을 아예
So the Seoul mayor eliminated all the regarding policies.
그밖에도 한 장인
He has also fired 400 workers who were promoting the UN Convention on the Right of Persons with Disabilities. which was created to guarantee the labor right of people with the most severe disabilities, including those who have been deinstitutionalized. In addition, so may Oh Se-hoon visit European countries such as Denmark to promote the existence of small group homes and good institutions.
홍보를 많이 했고요. 한국의 시절 방문을
He tells people with disabilities
시절
who want to deinstitutionalize that they may have to return to institutions.
돌아갈 수 있다고 하고 언론을
So he basically warns those people with disability.
그래서
And in the media, he said, the mayor said that the DI and living in the community is astronomically expensive. In response, conservative politicians in South Korea have distorted the concept of deinstitutionalization, saying that DI is a choice rather than a right.
한국의 대통령 윤석열 인지도 역사에 이런 정치적인
One politician recently interviewed in the media saying that DI is not the answer and that it should be investigated to ensure that people are not deinstitutionalized improperly.
소스가 가는지 문제하고 소스가 가장 페이지를 문제하고 하는 게 정치권 상황이 끝 같습니다. 그래서 중앙이나 지금까지 그렇듯이 계속 가야차게 수행을 계획 중입니다. 우선은 중앙이나 유엔 장애인 권리위원회 답변한 유엔 이티가 사실에 가리안이 맞춰서 소규모 수술 포함 모든 수술을 폐쇄시키고
We are working to close all, the SADDR is working to close all institutions, including small group homes, in line with the DI guideline, and we are preparing 3 laws to support DI, of course. We expect extreme hatred from religious communities and organizations that oppose DI.
공격하고 전체들이 혐오같이 많은데
However, we will try to pass the Closure Act to close all institutions in South Korea. The Compensation for Survivors of State Violence Act, which defines institutionalization as state violence and mandates compensation. also end the DI Support Act, which
빨리
investigates institution
예,
and support
그쪽에
survivors.
오시영 시진과 생각이 어떤 게 열렬히 알리고 왔고요. 한국의 터지는 망했는데 여러분들이 같이 좀 독립하여 같이 좀 싸워줬으면 좋겠습니다. 네, 그렇지. 이해 이해 이해
I think this is a great space of solidarity, and we need more solidarity in response to such hatred around us.
군장님이 일본에 가게 되었습니다.
We still need a lot of solidarity to do this work, which is why this November we are also sending a second delegations to Japan. Japan is a country that still operates many residential institutions. SADD will visit Japan and meets with various organizations to seek international solidarity and struggle together.
이 자리가 이 연대 한 공간이잖아요.
So I do believe this great space, this is really good space for our solidarity.
한국 사람아 쌍이 아니고 여러 국가들이 저희들 좀 전좀 관심을 좀 가져주기.
I would like to ask the many activists and organizations in this room to join me in transforming communities to end discrimination.
함께 모여서 싸워야지. 만빨리 좀 먹히지. 한국 사람들이 안 괜찮아요. 장애인들이 한국인만 거의 또 아니고 너희 국가의 마음에 진짜 주의를 갖다 좀 관심을 좀 많이
People with disability is not just in South Korea, it's in everywhere. It's a global problem. The discrimination is in global wide. So I hope you do join for the solidarity and we can fight together. We do need solidarity.
Thank you so much. Very strong statement, Mr. Kyushik Lee. And yeah, and thank you for the amazing work and advocacy around deinstitutionalization of persons with disabilities. Thank you for highlighting and exposing how the government of Korea has been reacting on this issue, and all your efforts towards transforming communities and connecting with various stakeholders and asking for international solidarity. I think it's very important. And you have rightly said that any form of confinement which segregates a person from the mainstream community is institutionalization. We need to see, because we have also seen this, and these small residential institutions, they are just coming up in big numbers everywhere, either in the name of care or in the name of independent living centers or rehabilitation centers. And there are different names which are given to these small institutions. And it is very important that people understand what is institutionalization. Thank you for highlighting about the deinstitutionalization guidelines. And as part of the global coalition on deinstitutionalization and the GCDI, we played a very big role while drafting the guidelines with the CRPD committee and along with other stakeholders. I think at this second anniversary, it is extremely important that all stakeholders who have been working on the issue of DI get together as a movement, build solidarity, advocate for the implement. And we need to now focus that, okay, this document is here with us. We have the best practices, how we can best implement the deinstitutionalization guidelines. And there are many stakeholders I hear who are not even aware of the DI guidelines. And I think we must build corporations towards dissemination of the guidelines as well as building the capacity of the stakeholders and OPDs to lead the implementation. So thank you so much for all your work in Korea. I will now move to our next speaker and invite Ms. Hanbyul Choi, who is associated with the Korean Disability Forum and has been conducting the role of and has been doing a big role of bridge building for the movement in Korea with international stakeholders for the effective implementation of CRPD as well as on the issue of deinstitutionalization. Hanbyul, the floor is yours.
Thank you so much for having me here today. And before I start, Kyusik Lee, who is sitting next to me, he wants to speak one more sentence. So I just want to spare some time for him before I start.
네, 아니, 제가요. 네, 제가요. 그게
I want to say one more
장이
thing.
당연히 아니네.
The guideline, the DI guideline,
아니라 아니라고 진짜 그게 뒤에 알고 두고
is not everything. We must implement that guideline.
완전히
쓰레기가
쓰레기가 아니다.
아니라
So the guideline is not the everything.
그거하고
하고 똑같다.
So we must try to effort
그렇게
to
알려야 된다.
implement. So we need to promote the I guideline to be implemented.
Thank you so much. So good day, colleagues. I'm Hanbyul Choi from the Korean Disability Forum. And as you might know, in August 2022, the Korean government was reviewed by the UN CRPD committee. So when I went to Geneva, Switzerland, and to attend the review session, I was able to meet with many organizations of persons with disabilities, especially with we could meet people from our colleagues from Japan. It was really delightful. And I learned that we are facing many of the same issues, both in Korea and Japan. So in September of that year, after the CRPD committee's concluding observations came out, we organized a global disability conference with other organizations from several Asian countries, which had been reviewed during the same session of the UN CRPD committee. So to this day, we thankfully still network with the colleagues from Japan, Bangladesh, and Indonesia, and Mongolia. Thank you. And our connections have lasted this long because we have found common grounds and common goals to work towards together. So the goal of, as you might know, that disability organizations around the world is the full inclusion of persons with disabilities in the society, right? So we identified the main obstacle to inclusion of the persons with disabilities was institutionalization. You know, institutionalization is not only about buildings, but also the practices that confine people. All right, the translation is going well. Okay, I will keep going. And there is a trend of residential institutions for persons with disabilities operated in countries such as South Korea or Japan being exported to the countries in Southeast Asia where disability welfare policies are beginning to develop. And there is also the situation of persons with disabilities being confined to their own homes, where the social activities are hindered by the high level of stigma and discrimination, and also the lack of accessibility and mobility. So the persons with disabilities being deprived of their legal rights, as you all might know, that which prevents them from making key decisions about their own lives, is also a problem that knows no borders. So even when terrible human rights violations occur in institutions, even which led to the death of persons with disabilities, society consumes these human rights violation cases as one shocking event, but fails to turn them into a momentum for deinstitutionalization. So this is because of the horrific ableism within our society that sees the lives of persons with disabilities, especially those living in institutions, are worthless. So it was amazing that in September 2022, the UN Committee of the CRPD issued the guidelines on deinstitutionalization, which we mentioned still. It is because the issue of institutionalization is serious, not only in Asian region, but also at the global level. And the committee and the global disability community have come together to address this huge human rights violation. So these guidelines on deinstitutionalization gave another basis for us to speak up together, along with the UN CRPD and the General Comment number 5. So it proves that the right of deinstitutionalization and independent living that we are demanding for the governments is not only our own perspectives, it's not only our talks, but it has the internationally supported and recognized. And it is a source of pride that we have for having each other's backs. So we, not by the experts, but in colleagues with disabilities all around the world, we could make these guidelines. So yeah, so in celebrating the guidelines, the Asian disability community has declared to come together and promote the deinstitutionalization movements in Asian region. So on 18 August 2023, disability organizations in all over Asia, including South Korea, Bangladesh, Indonesia, Mongolia, and Japan, etc., issued a statement around announcing the launch of Asia Coalition on Deinstitutionalization. So we started meeting through online platform, or we met via Zoom and used Notion to achieve our minutes and activities. And it started out as just getting together and talking about what is going on in each country. So as we continue our conversation, we could slowly evolve into a concrete solidarity. So we joined our colleagues in Nepal in their struggle to demand policies and funding for community support, such as personal assistance. So we wrote letters to the Nepal embassies and had a press conference and demanded that they, we could do these campaigns for solidarity. So yeah, I will skip this part. And so maybe COVID-19 has caused us a lot of heartache, but it is also allowed reveal the shadows in our own in our society. So it has been important. Also, it has been a ground for making up with the guidelines on deinstitutionalization. It also allowed us to meet internationally more easily and frequently thanks to the development of the online platforms like Zoom webinar like today. So yeah, so So now we can use not only offline meetings and our solidarity in person, but also we can use the online platforms, not only Zoom webinar like today, but also like sending emails to the embassies or the other countries' governments, etc. So yeah, we have more grounds and more measures to be together. So I just want to end by asking for your advice, because we can do we attend like international conferences, and we can make joint statements, and we can create guidelines together, but we can organize, but what does it take to ensure that our actions bring a real change in each country and in Asian region? So how can it change the physical world through our connectivity? So yeah, it is a question that might seem vague, too big, but I've seen, I have lots of experiences by solving problems together. So without no doubt, I just wanted to ask your advice about these questions. Thanks for your attention. Thank you.
Thank you so much, Hanvil, for your remarks. And yes, many issues in most of our countries are similar, but they're just similar small, policy change levels. And specifically in most of our colonized countries, where we have the mental health laws and we share like common issues. So it is important that countries come together, and like you connected with people in Japan. So I think um, all OPD civil society organizations should take this approach and connect with each other. And in TCI, we have been doing this as a movement for connecting and building solidarity between the movement and supporting each other, sharing best practices, learnings. So yeah, and thank you for highlighting more in depth the issues people with disabilities face in the name of confinement. And specifically, what happens in the institutions is even more horrific. Thank you also for highlighting about some history about the COVID-19 protocol report, which revealed the issues faced by people with disabilities inside the institutions, and how they are totally segregated from the mainstream communities. And thank you again to all of the organizations who worked with the CRPD committee, along with other several stakeholders, to develop these guidelines. And the guidelines give us a clear picture of what should be done and what are the types of stakeholders should be involved in the process. So without any delays, and we must take it as a global issue and work in collaboration to transform communities for inclusion. So we will now move to our next speaker, and I will request Mr. Hiroki, who serves as a board member for Disabled People International in Japan. And over to you, sir.
Thank you. Thank you, Walker. I'm Hiroaki Furihata, board member of DPA Japan, and thank you for this opportunity of sharing. And yes, my presentation does not directly focus on the issue of deinstitutionalization, but on DPI Japan's activities to arrange the basis toward the deinstitutionalization in international cooperation. So, okay, so as a member of DPI World, DPI Japan has concerned with many activities of international cooperation through the network of DPIs in the world. And in Asia Pacific region, we jointly organized or participated in the regional conferences, meetings, and workshops in the framework of DPI Asia Pacific. And in this September, the regional conference assembly of DPI Asia Pacific was organized in Seoul, Korea, to elect the new executive members and discuss the direction of our activities. So while having international activities in the framework of DPI World or DPI Asia Pacific, we, DPA Japan, also organizes its own activities of international cooperation. So in this opportunity, I would like to share our activities and experience. But before sharing, I briefly explain the DPI Japan's stance towards international cooperation at the basis of our activities. So the stance of DPI Japan, which is for aiming the mainstreaming of persons with disabilities, is known as twin track approach. It is an approach to focus upon two aspects. One is the empowerment of individuals and organizations. So we organize programs for the capacity building of persons with disabilities and related people. We also provide resources to strengthen the activities of their organizations. The resources include not only the fund for activities, but also technical information for the management of the organizations. But if, however, the system of society or society itself, such as accessibility, policies, or awareness are not inclusive, mainstreaming of persons with disabilities cannot be realized. So as the other aspect, we focus upon the change of the system or social change to facilitate the inclusion of persons with disabilities. The improvement of accessibilities of public transportation or the establishment of public program for personal assistance service, example of the system change. So based upon this twin track approach, DPA Japan conducted several programs of international cooperation, actually many programs of international cooperation. Here are some cases. In Asia Pacific, DPI Japan assisted the research for the introduction of the concept of universal design into the transportation sector in Vietnam from June 2007 to September 2009 with the funding of the Japan Bank for International Cooperation. And in this project, we organize seminars on universal design, assist the research of public transportations, and held the series of meetings with the government and NGOs in Vietnam. And in South America, we organized a project for HIV/AIDS education for illiterate persons with disabilities through empowerment of the deaf people's organizations in Brazil from 2008 to 2013 with a fund of Japan International Cooperation Agency known as JICA. This project assisted the empowerment of groups of deaf people while developing the educational materials of HIV/AIDS for deaf community. So empowered deaf people became agents for education on HIV/AIDS and then incorporated in the government awareness raising project. So in this both project, we can recognize the two aspects of approach. So one is empowerment and other one is a social change. And then our recent focus of international cooperation is Africa. To this region, DPI Japan organized a series of program courses for capacity building of African leaders with disabilities from 2002 to 2019 under the scheme of JICA Knowledge Co-Production Program. The program courses were held in Japan for 3 weeks with supplemental 1 week program in Thailand and shared the knowledge on the community-based support activities for independent living of persons with disabilities. In entire courses, the program assisted empowerment of more than 160 African leaders with disabilities and 20 government officials. After the courses, they utilized the knowledge in their own activities and committed to the work of social change. So this empowerment of African leaders encouraged us for further concern with Africa for realization of mainstreaming of disability. The case of this cooperation is a project in South Africa. In 2013, as a project of Human Care Association, a member of organization of DPA Japan, capacity development of persons with disabilities for the establishment of DPA Japan of independent living centers began with local disability organizations with a fund of JICA partnership program. The seminar and workshops, both organized in South Africa and Japan, supported the capacity building of persons with disabilities and the personal assistant for independent living centers. And they established 2 independent living centers in Gauteng province with model services to support independent living in the community, such as personal assistance services for about 40 users, and also consultation and peer counseling for the community. The Gauteng provincial government recognized the significance of this project and started to provide the fund for sustainability of the services as its pilot project in July 2016. So DPA Japan succeeded this project in September 2016 for the improvement of the accessibility of housing and transportation in the same project area. The project worked to show some model cases of renovation for accessible housing and wheelchair lift van transportation services. For February in 2024 this year, we launched a new phase of the project to roll out the concept of independent living and services for this in entire this Gauteng province, while further developing the capacity of disability leaders to strengthen the management of independent living centers. So we expect the project will lead to the establishment of the support system of independent living as a public program. So I think a participant already know that with that establishment of a support or improvement the support system in the community, the institutionalization is really difficult. So we hope this DPI's activity can be a model case of to make a basis or ground towards the institutionalization. So as a conclusion, so based upon this twin track approach, DPI Japan has committed many projects of international cooperation. We hope our grassroots activities will lead to the realization of inclusive society in the world where anyone can live with its own rights. So thank you very much.
Thank you, Mr. Hyoki, and thank you for highlighting how important it is to empower OPDs of people with disabilities, because until we create more and more OPDs and we work with them on their capacity building, the change may not be possible at the national level. You also touched upon the technical information and internal systems of OPDs, which many OPDs lack today, due to which they are left out. And we must, keep working, supporting, allocate funding for OPDs to grow. Thank you also for highlighting about the awareness raising, and because it is very important part to transform communities and to mobilize a momentum at the national level for inclusive policies, as well as you will in TCI also we say that, okay, if we have those services, if we create more and more services, for example, there is transportation, there is education, there is social protection, there are all these services in place, but without support systems within the communities, it is impossible to prevent institutionalization and to transform communities and make those communities inclusive, to provide that support to people with disabilities to live independently in the communities. So support systems is super and very critically important for enabling independent living of people with disabilities. So thank you so much for also touching upon this. We will now move to next speaker, Mr. Ganesh KC, the General Secretary of Center for Independent Living in Kathmandu, to share his experience of working and advocating on DI in Nepal. Ganesh, the floor is yours.
Namaste, good morning, good afternoon, annyeonghaseyo, konnichiwa, etc. I'm Ganesh KC, General Secretary of Center for Independent Living of Persons with Disabilities. Thank you for this opportunity. I like to read my speech. It is in a written format. My topic is Nepal Disability Right Advocacy with International Solidarity. Dear Chairperson and all distinguished guests and representatives, first of all, I would like to extend a warm greetings on behalf of CIL Kathmandu and my country Nepal. Namaste. I'm extremely happy to have the opportunity to share some thoughts on behalf of my organization and country at this prestigious gathering of the Global Disability Conference, and I express my gratitude to the Korean Disability Forum, Asian Coalition of Digitalization, ACDI, and the other organizer for providing this opportunity, this beautiful opportunity to us. In fact, in civil society organizations play a crucial role in the socio-economic development of a country. The role of civil society is considered highly successful, preliminary in raising awareness about among the people, building their meaningful participation and ownership in the development process, disseminating knowledge and skills, making citizens aware of and mobilizing them for development, and institutionalizing democratic practice in society. Similarly, civil society organizations have played a very effective role in making the state accountable for the implementation of rights of people, establishing the issue of marginalized groups, and holding the state accountable for addressing their issues. We have a good experience on this in our country as well. However, sometimes the state ignores and does not prioritize the voice raised by the civil society. The issues are extremely important, but we have to struggle a lot to draw the state's attention to these issues. Sometimes, even after much struggle, the government does not pay attention to some issues. We have experienced that on hand, the states remaining silent on some important issues, and on the other hand, we haven't been able to properly establish some issue in society due to the lack of resources and such as financial, technical knowledge or skills. We are in organizations working for the rights of person with disability. We too have achieved very good result at the legal and policy level through the organized activism of organizations run by people with disabilities. But in the current situation, the government has not properly incorporated the voices we have raised for the effective implementation of these political and legal provisions through programs and plans. We are currently fighting for this, and we know that we will have to struggle a lot in this regards. Our country lies in the South Asia. In our experience, the state of the disability right movement is almost similar in many South Asian countries. Although government in this region have initiated some good legal provisions on disability issue, but they have not yet been able to accept it is a development issue in terms of implementation. Looking at the state of implementation of disability right, the issue of the disability has not yet become a part of the government's budget and program. Until there is an adequate budget and program for the implementation of legal provisions, no change can be observed in the lives of persons with disabilities. For this, the government needs to implement inclusive programs by incorporating disability issue into its various development programs, as well as implement program targeted to persons with disabilities. However, to make government accountable on this issue, The role of organization of person with disability must be very strong and effective. Organizations of person with disabilities need support in all aspects such as technical, financial, technical skill, knowledge to make them strong and effective. Thus, the solid international solidarity is necessary for the effective implementation of the organizations of persons with disabilities. Such as solidarity is also necessary among international network working on disability issue and development partners supporting the promotion of disability right. The development partners need to understand the local priority of the person with disability in the real need, local context and conditions, and develop investment strategy accordingly. The local challenges are not the same in all countries. The support plan need to be prepared to address challenges according to the country and context. This may require study and research, and collaboration with organizations of persons with disabilities can be very effective in reaching the right information during the research process. Similarly, we can also use international solidarity for advocacy. The practice of disability right activists from the country supporting and standing with the issue of person with disability is another country strengthens the pressure on governments. We also have good experience with this. Some time ago, in a campaign we conducted in Nepal to implement the legal provisions regarding the personal assistance service, we received good and active supports from the Organization of Persons with Disabilities and OPDs in Korea, Japan, Thailand, Philippines, and other countries. We can also practice a common network that connects issue from the different countries, and we want this assembly to discuss such possibilities as well. Finally, I would like to conclude my thoughts here by once again expressing my felt thanks for giving me this opportunity to share some words on this grand occasion. Thank you.
Thank you so much, Ganesh, for your extraordinary work in Nepal for promoting independent living of people with disabilities and working in collaboration with other disability organizations. And then the point which you said is very accurate, like because it is very important that the donor organizations they connect with the grassroots OPDs, because OPDs at working at the grassroots community know what the issue is and knows what the solutions are. They are well equipped with the best. They are well equipped with the solutions and what are the challenges. So I think like it's very important that the donor agencies, and we should make this recommendation that donor agencies should connect with the grassroots OPDs for and build partnership for working at the national level. And at the international solidarity part, whether we are doing one program or we are doing 2, 3, 4, 5 programs, it is very important that we keep that connect and solidarity between the organizations and share the learnings and best practices which can support other organizations to who are working on a similar program, and something innovative could be built there. So thank you so much, Ganesh. So we'll now move to the our last three speakers and the last panel discussion of the event, where we will listen to the leaders who have been working for decades on building international cooperation. And I think it is the most important part to do. And we must be transparent and open to take advices, mentorship from our senior leaders who have been working in the sector for decades. People have given their lives, and we must respect that. So first of all, I would invite Ms. Maulani Rotinsulu from ASEAN Disability Forum to share her suggestions and comments. Maulani, the floor is yours.
Thank you, Wakar. So everybody, can you hear me clearly? Wakar, can you
Yes,
hear me?
all good, all good. We can hear you. Yeah.
Thank you so much. So Good afternoon, everybody from Indonesia. So I was asked to talk about those towards stronger solidarity in regions, in regional civil society cooperation. So I'm Maulani Rotin Sulu, the ASEAN Disability Forum Head of Secretariat and also the General Secretary. I'm based in Indonesia. So ASEAN Disability Forum is officially acknowledged by the Association of Southeast Asian Nations, or ASEAN, in the document of Bali Declaration on the enhancements of the role and participation of persons with disabilities in ASEAN community. So allow me to introduce a brief relating to how ADF was established. So there is a CSO movement in ASEAN called ASEAN People Forum or ASEAN Civil Society Conference that have been established since 2004. It serves a platform for regional civil society to raise concern, advocate for change, and promote the more just and democratic Southeast Asia. DPI at that time, DPI, Disabled People International Asia Pacific, had been engaged with this forum since 2000s. After disability has its convention, the CRPD, and then ASEAN People Forum always been involved and support the dialogue of disability issues and encourage the voice of disability in ASEAN community. Several talks within the region, including APCD, DPI Asia Pacific, talking about how the engagement of persons with disability in the Southeast Asian nations. Through this advocacy and dialogues, the initial recognition of ASEAN disability was established in the document of ASEAN Declaration 2011. So, ladies and gentlemen, relating to the civil society movement on disability, I would like to bring up the situation of Indonesia. So, the first movement on disability in Indonesia started from 1960, the Indonesian Blind Union. I think similar types of movement grew up in countries of Asia. However, this movement can be progressively to be a regional and even international movement. It is because we believe that all human, whatever they from, whatever country they're from, we have similarity of humanity. That is how the solidarity grow up. We all know that mostly CSOs, including OPDs, born from the unsatisfaction feeling of minority groups of society due to discriminations, neglected, inequality, violence, injustice, oppressions, and many things that have been there in making it deserve to be fights for or fights against. And when it comes from the perspective of human rights, the issue becomes global or international issue. However, CSO having a lot of obstacles and challenges, as well as to move forward as alone fighters or movements. The idea of developing international solidarity raised to overcome the minority issues and challenges. What is the international solidarity? It is the expression of spirit of unity among individual, people, CSOs, actors, businesses, states, and international organizations to pursue network multilateralism, promoting social cohesion and trust. So, a definite practical example of how international solidarity can make civil society stronger in international commitment in solidarity to support the principle of meaningful participation of people and the community with disabilities in CRPD being a main part to make disability CSO stronger, so that now all international community, national government are consulting to disability or CSOs or OPDs. So I would like to conclude the presentation by adding one challenge that I would like to acknowledge. Here is the support to make OPD being professional in their work is still limited, including opportunity to learn, building the capacity, including capacity to involve professionals with disabilities. Mostly their works are voluntary based. I should say there is no guarantee that even your organization has already in the official commitment, the government will support your capacity building. So thank you very much for the attention. I ended my presentation here. Thank you.
Thank you so much, Maulani, for this amazing recommendations and suggestions. And thank you for sharing how we can promote the international solidarity between CSOs. And you have rightly said that international commitment to international solidarity is key and is very important. I just want to share one example that recently TCI and KDF and ASEAN Disability Forum. So we are all working together and we are sharing a space in November also. So that's like one partnership example that we are doing for our conference next month. So, and this is how we keep building. And I think there were two events like we partnered with ASEAN Disability Forum in this year. So thank you so much for this partnership also, Maulani, for and your support and solidarity, because we need to move together as we share common experiences. So we'll now move to the next speaker. I would like to invite Ms. Rubina Alambuya, the President of Transforming Communities for Inclusion. And at TCI, we have been working for almost a decade now to mobilize multi-stakeholders and dialogue for our inclusion in development agenda, in SDGs, including in our involvement in the civil society consultations, deinstitutionalization, and we are happy to share our experiences, learnings with all stakeholders. The floor is yours, Rubina. Over to you.
Okay. Thank you so much, Waka. The organizers and our esteemed speakers and delegates at this Northeast Asian SDG Forum side event in 2024 Global Disability Conference. I would like to say peace as I acknowledge the author of life. Yes, I'm Rubina Nakanwaja Alambuya, President of Transforming Communities for Inclusion Global. And I'm from Uganda, the Pearl of Africa. We share love and solidarity. I am a woman with psychosocial disability. In TCI is a global and independent voice of persons with psychosocial disabilities that was birthed in Asia and spread to the other regions of the world, including Africa. So I'm so blessed to connect with the Asian movement. TCI's goal is to build a right-based momentum at the national level and establish a movement of organizations of persons with disabilities to work with national policymakers and development actors. TCI plays a vital role in driving advocacy from a right-based perspective in accordance with the UN Convention on the Rights of Persons with Disabilities. So TCI mobilizes and builds capacity of members to engage, of members at the grassroots national level to engage in regional and global advocacy spaces like this one today. TCI Global is bringing at a regional and global policy spaces what has worked at the grassroots communities to prevent institutionalization and advocate for deinstitutionalization, supporting community inclusion, just like what they have done in a rural community where Triumph mental health support in Uganda is. Now, in these few minutes, I was also asked to speak on how can the international solidarity lead to improve the minority rights at the national level. I would like to say that international solidarity, as it has already been said by many other leaders, leads to advocacy from a right-based perspective, and it mobilizes and builds capacity of grassroots organization at a national level to be able to engage, just like I've said TCI is doing, at regional and global advocacy spaces through partnerships with global civil society organizations, so that we can be able to see change and transformation. And we have examples on how international solidarity can strengthen civil society. I can give an example, the recent example. This year, in this month of October 2024, my grassroots organization called the Triumph from a rural community was only able to share issues of girls and women with psychosocial disabilities before the UN CEDAW committee through its affiliation with TCI Global. And then TCI Global partnered with Women Enabled International, who supported both our organization, the grassroots local organization, and the global network, which is TCI. We were supported by Women Enabled International to travel to Geneva and meet the CEDAW committee, presenting our issues. And this was only possible because of international solidarity. That's the best example in this short time I can give. There are many other examples, but because of the limited time, I've only given that one. So in conclusion, for the Sustainable Development Goals to be realized everywhere, for all people, across all ages, then networking, collaborations, strategic partnerships, and solidarity are needed. Thank you so much. Webale.
Thank you so much, Robina, for the statement and suggestions and feedback. I just wanted to say what you were saying. You rightly said that at TCI, we are a post-CRPD movement, and we see us, and we have been working on with the stakeholders to see us from the CRPD perspective and not from the mental health perspective. And I would say that TCI itself is one of the examples of international solidarity. We started from one organization, one country, and with the support from our cross-disability stakeholders and other stakeholders, we are today a global organization which is having representation in 50 countries. So it is a very prominent example of international solidarity, of supporting a movement. So cross-disability stakeholders have been our key allies to steer our conversations in SDGs and our inclusion in the development agenda. So thank you so much, Robina, for highlighting that. And with this, we will now move to our last speaker of the day. I would request Mr. Rejaul Sadiq from Bangladesh, who has the experience of working with many international stakeholders and is also a public lawyer at the Supreme Court of Bangladesh. And we would love to hear from you, Reja. Over to you.
Okay. Thank you so much again, Walker and organizers for inviting me to this conference. Hello, everyone, my dear colleagues and comrades. I do agree with all the recommendations, suggestions made today. And now from my side, I would like to present some suggestions or recommendations as requested. These are my personal and based on my working experience in Bangladesh, particularly in the South Asian region. Firstly, I would say that we must concentrate on the nation's general state of human rights, the rule of law, and good governance of the state. Nothing will help the marginalized and socially excluded populations, including the people with disabilities, if the nation does not uphold the role of law, good governance, accountability, and transparency. This is because the government and other stakeholders will not prioritize their concern in a system of lawlessness. Let me give an example like 2.5 months before, in my country, there was a stable situation, social tranquility, there was a stable government, and the disability was a priority for all stakeholders, including the government. But in between, in 2.5 months, the situation has been changed. Government has been overthrown, and interim government takes oath, and now disability is not a priority for government. So this is why I'm stressing on the overall stability of the particular countries. Everybody should focus on the good governance, rule of law, and human rights situation, overall situation. Then we can speak about any particular communities. Secondly, all human rights instruments must be upheld in every situation by international solidarity. This is my personal opinion from my experience. Again, I'm telling, discussing the CRPD while disparaging the other conventions actually will gradually weaken our voice. As law students, we believe the equity must be practiced if one desires it. If anyone ignores equity, he or she can't claim equity. This is why I'm stressing on the upholding all rights and conventions for all, not for a particular community. This is my view, and again I can give example. For example, many of our men with disabilities who are strong leaders, but they don't recognize the CEDAW mandates or the rights of women and girls, and this is why they lose their morality. Like the government or other stakeholders do not feel interest to listen to them. So this is why I'm stressing on the upholding the all conventions, not only the CRPD. Thirdly, I would say that all communities or the stakeholders or civil society organizations, international global solidarity must distinguish the OPDs and the CSOs. We know, according to the general comment number 7, there is a huge difference between these two. There is a difference between governance. There is a difference between the operational system. So if the donors, funders, or other international corporations do not recognize this distinction, in fact, it will be harmful for the disability movement, because OPDs and CSOs are not the same, and you can't treat this both in the same way. Fourthly, I would say that we should recognize the diversity. Like, I'm a person with physical disability. If I tell about only the rights of persons with disabilities, and I don't look at the other disability groups, then actually I will lose my value and my voice will be weaker. So this is why I would say I would suggest to look at the diversity. And lastly, I would say international sharing, like what we are doing today, like sharing of information, opinions, ideas, insights between regional, local, and global forums, civil society forums should be increased. In my life, I have learned a lot from African Disability Movement, from KDF, from TCI, and particularly about the deinstitutionalization. I was zero. My knowledge about the institution was zero, but I have learned everything from TCI and other organizations who are working with the institution. So this sharing helped me strengthen my knowledge, and now I'm contributing to the Bangladesh Disability Movement to launch the programs for deinstitutionalization. So this kind of sharing insights should be increased. Sorry for taking much time. Thank you all for listening me. Walker, over to you.
Thank you so much, Reja. We are just running out of time, and there are so many questions in the chat box which are coming up, and we will definitely want, like, we can connect back with you over the email, because I was just informed that we have to leave the room, which is inside, like the physical people who are attending the event physically in Korea, they have to, vacate the room in few minutes. So thank you so much, Reja, and all of the speakers. Reja, you raised very important points that during the international cooperation or multi-stakeholders agenda, it is very important to uphold the rights of human rights of people with disabilities. Another important point that OPD collaboration is very important, and which is very minimal. And of course, and OPD CSO partnership is also very important. And it's the role of the CSO then to see how the CSO or the donor agency can, make sure that all voices are included in their works. So thank you, KDF, again for creating this space. And in closing, I would just mention that in TCI we are working on a community inclusion tool, and the institute which is for preventing institutionalization and supporting the DI agenda. And our doors are open for working together with stakeholders and collaborate on the subject of deinstitutionalization and inclusion of women, youth, and diverse people of disabilities. In the end, I would say that we must believe in the power of a movement of people and peers moving together, empowering each other during the journey, and not working in silos, because working in silos will not have any gain or any output. We must keep fostering strong collaborations with all kinds of stakeholders during our work at national, regional, and global levels. I will stop here and will hand over back to Hanbul Choi for the closing remarks. Thank you.
Thank you so much, Wakar, for your amazing moderation. And it is always so glad hearing from our colleagues and their stories and their insights. So we don't know where the time has gone. So yeah, it's always amazing to hear from you. And thank you so much for everyone for today joining us today. And thank you for our participants for amazing questions. Since we are out of time already, sorry about this, but I'm sure that we can get in touch with you via email, since we all have your emails. Yeah, please please leave your email, since we our webinar is not requested on registration. So could you please leave your email, then we can contact with you via email. Yeah, I can I can see also for some questions we already left some answers via chat box. So I hope that it was enough for you, for the participants. And thank you so much again, and hope that we can have another time. Maybe next time it would be enough for us to share our stories. So thank you so much, and see you around, and let's get stronger together. Thank you so much. Thank you.